Students, today we will be talking about vitamin C. Vitamin C is a water soluble vitamin and chemically it is known as ascorbic acid. Okay, the structure of ascorbic acid looks like a monosaccharide structure. I'll show you in the later slides. Vitamin C exists in two forms. One is the reduced form and one is the oxidized form. So, L-ascorbic acid is the reduced form, and when it is oxidized, L-dehydroascorbic acid is made. Okay, so these are two forms, ascorbic acid and L-dehydroascorbic acid. So, the acidic property of vitamin C is due to the enolic hydroxyl group that they have in their structure, and vitamin C is a strong reducing agent. Okay. Now, this I already told you that L-ascorbic acid, it undergoes oxidation to form dehydroascorbic acid, or dehydroascorbic acid can undergo reduction and form L-ascorbic acid. These ascorbic acid and dehydroascorbic acid are biologically active, the L forms. The D form is biologically inactive. This ascorbic acid is present in all tissues and plasma as reduced form. Okay? So, it is in the form of L-ascorbic acid. Oxidation of ascorbic acid is rapid in the presence of copper, and then it is oxidized to dehydroascorbic acid. This is the structure, this is the reduced and the oxidized form. This is a reversible reaction, I already told you. So, it does resemble a monosaccharide structure, right, a hexose derivative. Okay. Now, many animals can synthesize ascorbic acid in their body via a pathway which is known as uronic acid pathway, but man, primates, bats, guinea pigs, they cannot synthesize ascorbic acid due to the deficiency of the enzyme which is necessary for the synthesis, that is L-gluconolactone oxidase. You will be studying this uronic acid pathway in the second year. So, there is an enzyme L-gluconolactone oxidase. So, this enzyme is not there in us. So, we have to take vitamin C from the outside. It is readily absorbed from stomach and small intestine, and only small amounts can be stored, and it is present in this ascorbic and dehydroascorbic acid in different tissues like retina, adrenal gland, pituitary and thymus. Dietary sources. Vitamin C sources are all colorful sources. Okay, the citrus fruits, the citrus vegetables all have vitamin C in them, okay, such as lemon, oranges, grapes, spinach and tomatoes. Milk is a poor source of vitamins. So, a vitamin C plate should look like this, okay, so much color. The biochemical functions. As I told you that they have a reduced form and an oxidized form, they act as coenzymes in different reactions. They involve a reversible oxidation reduction reaction, they involved in that, and interconversion of ascorbic acid to dehydroascorbic acid. The vitamin C is a strong reducing agent. So, now we will talk about the functions. Okay. The functions, the main function to which the disease of the deficiency of vitamin C is also related is the collagen formation. Okay. Now, for the collagen formation, you have proline and lysine. Okay. Now, you know that there should be maturation and cross linking of collagen so that the capillary walls are strengthened. Okay. Now, proline hydroxylase catalyzes the hydroxylation of proline on collagen. Okay. Ascorbic acid and iron in the ferrous form are the cofactors in that reaction. Ascorbic acid is also necessary to keep the iron in the ferrous form which is needed in this reaction. Okay. Now, this is essential for maturation and cross linking of collagen. The hydroxylation is necessary for the maturation and cross linking of collagen. You will see this. Proline is converted into hydroxyproline by proline hydroxylase, and here ascorbic acid and ferrous play an important role as cofactor. In the same way, lysine hydroxylase catalyzes the hydroxylation of lysine, and here also ascorbic acid and ferrous ions are cofactors. I already told you vitamin C is necessary for iron to be kept in the ferrous form, and this is also essential for maturation and cross-linking of collagen. See the diagram? Lysine is converted into hydroxylysine in the presence of lysine hydroxylase, and here also ascorbic acid and iron are playing their role as a cofactor. Okay? And this whole thing, this hydroxylation and all, these all are post-translational modifications. Once the lysine proline are made, then after that the hydroxylation takes place for the maturation of this. So, in vitamin C deficiency, collagen synthesis is defective, delayed wound healing will occur, and thus vitamin C is also given after surgery to enhance the wound healing. So, it has a good role in wound healing. Now, in tyrosine catabolism, what happens? This para-hydroxyphenyl pyruvate is converted into homogentisic acid by the enzyme para-hydroxyphenyl pyruvate hydroxylase. This is also a hydroxylation reaction, and here also the ascorbic acid along with copper is playing a role. Okay? Ascorbic vitamin C has a necessary role in this reaction. Okay? So, first I told you the proline thing, then the lysine thing, and then this para-hydroxyphenyl pyruvate is converted into homogentisic acid. Here also ascorbic acid is playing as a cofactor. Then it has a role in catecholamine synthesis. Dopamine is converted into norepinephrine by dopamine oxidase in the presence of ascorbic acid. So, thus it has a good role in a necessary role in the making of catecholamines, which are your fight and flight hormones. Then it has a role in iron and heme metabolism. Iron and heme metabolism. What happens when the steps are taking place? Protoporphyrin 9 is made. Now, ascorbic acid has a role for the incorporation of this iron into protoporphyrin 9 so that heme can be made in the presence of ferrochelatase. Okay? So, ascorbic acid, what it does, it incorporates this iron into protoporphyrin 9 and is converted into heme. Then this heme combines with globin and becomes hemoglobin, that is the other thing. But in this reaction, vitamin C acts as a cofactor. Then, in the biosynthesis of bile acids, cholesterol is converted into 7-alpha hydroxycholesterol. So, you can say that vitamin C acts as a cofactor in the synthesis of bile acid. Okay? Cholesterol is converted into 7-alpha hydroxycholesterol. This is a step in bile acid synthesis, and vitamin C is playing a role. It also has a very strong role in bone formation, because bone tissues possess an organic matrix, collagen, and inorganic calcium and phosphate. So, vitamin C will be required for bone formation. Then in the tryptophan metabolism, ascorbic acid is necessary for the hydroxylation of tryptophan to 5-hydroxy-tryptophan. Okay, that is required for the formation of serotonin. Okay, your neurotransmitters. Then it has a role in iron metabolism. I already told you that ascorbic acid reduces ferric iron to ferrous state, which is the commonly absorbed iron. Okay. Then folic acid metabolism. I already told you in folate that vitamin C is required for the formation of tetrahydrofolate. If you see that reaction, vitamin C acts as a cofactor in there. So, it is necessary for folate metabolism and thus maturation of RBCs. It has this role in peptide hormone synthesis, because it hydroxylates glycine by peptidide glycine hydroxylase, which requires vitamin C in the peptide hormone synthesis. Then it has a role in steroid synthesis as a cofactor, as it is necessary for hydroxylation reactions in the synthesis. Then it has a sparing action of other vitamins that act as an antioxidant. Ascorbic acid is strong antioxidant. Then when it is acting as a strong antioxidant, other antioxidants can just relax. Okay, so it spares vitamin A, E and some B complexes vitamins from oxidation. Vitamin C, it increases the synthesis of immunoglobulins, thus it has an immunological function and thus increases the phagocytic actions of leukocytes. So, it has this police function, the immunological function also. So, I already told you that vitamin C is concentrated in the lens of eye. So, regular intake of ascorbic acid reduces the risk of cataract formation. Vitamin C is an antioxidant. This has been repeated so many times. This is a very, very important property, okay, because there are so many functions that are just based on this antioxidant thing. It reduces the risk of cancer, coronary heart diseases. The RDA for men, it is 60 milligram per day, women it is 60 milligram per day, pregnancy it is increasing 80 milligram per day and lactation 100 milligram per day. So, deficiency. If you just keep in mind the functions, you will just be able to write the deficiencies by just reversing it, that if it is necessary for heme synthesis. For example, it is necessary for heme synthesis. So, if there is no heme synthesis, there will be no hemoglobin and there will be anemia. Okay? So, you can write the deficiencies by yourself. Let us see what they have given us. So, mainly the deficiency is due to deficiency of the dietary vitamin C, and if there is increased demand and you are not fulfilling the demand in pregnancy, lactation, surgery or burns and all, or if there is impaired absorption due to some intestinal disease. The main disease related to vitamin C is scurvy. Okay, scurvy. We will talk about that. In infants between 6 to 12 months of age, diet should be supplemented with vitamin C sources, otherwise they will have infantile scurvy. Okay. So, what happens in the whole scenario is there is hemorrhagic tendency. In ascorbic acid deficiency, collagen is abnormal. Okay. Then the intracellular cement substance is brittle. So, capillaries are fragile. The capillaries are fragile. So, any minor pressure is gonna just make them bleed. So, leading to the tendency to bleed even under minor pressures. So, there could be petechial hemorrhage, small hemorrhages due to rupture of capillaries resulting from lack of intracellular substance. Then ecchymosis or big bruises or even hematomas, which is like blood filled swellings in severe conditions. Okay. Internal bleeding, in severe cases hemorrhage may occur in the conjunctiva and retina in the eyes. Okay. See, mainly it affects this bleeding, these gums which get swollen and spongy. Okay. Spongy swollen gums is the main hallmark of scurvy. Okay. Where there is lots of bleeding even when brushing, even when not brushing, even if you have this minor eating while eating something, and then if it is not treated, the dentine is just gets separated from the gums and people start losing teeth. Okay. So, look over here, this is bleeding gums. Okay. This is petechial hemorrhages, small hemorrhages. Then there are ecchymosis, okay, purpura ecchymosis, bruises. Then these are perifollicular hemorrhages, that is the hair follicle, around the hair follicle you have hemorrhages. Then anemia, it can cause anemia because there is bleeding. Then joint effusion or hematomas, I was saying the collection of blood in this knee is the knee hematoma, joint effusion. Then nail hemorrhages, these are splinter hemorrhages. So, these are all because of vitamin C deficiency. In oral cavity, in severe cases of scurvy, the gum becomes painful, swollen and spongy that I already told you, and the pulp is separated from the dentine, and finally teeth are lost. Wound healing may be delayed, okay, and you will be more prone to infections. Why? Because I already told you vitamin C has this immunological functions, okay. It is necessary for the phagocytes and all to work, okay. Then if vitamin C is deficient, your immunity is coming downwards, thus you are not able to fight against germs, and you will be more prone to infections. Bones, the deficiency results in failure of osteoblasts to form the intercellular substance, thus your bones become weak, the deposition becomes arrested, the bones are weak and fractures easily. There is hemorrhage into joint cavities that I already told you. Vitamin C and B are essential nutrients to maintain bone density and bone quality, okay. So that's why there is easy fracturability in these patients. Anemia is also one thing, you bleeding from everywhere, you're not making hemoglobin. So deficiency, there is normochromic, normocytic, when the cells are normal in structure and size and shape, that is due to bleeding. If they are megaloblastic, that means there is reduced erythropoiesis, okay. And if they are microcytic, due to impaired iron absorption and impaired heme synthesis. So 3 types of anemias they have told you due to different reasons. On the whole, you can just say that there is anemia in vitamin C due to bleeding or due to reduced erythropoiesis due to reduced iron absorption and heme synthesis. Fatigue, depression and susceptibility to infections are associated with vitamin C deficiency that I already told you. So, therapeutic uses, how can it treat something? There are beneficial effects of vitamin C in treatment of TB. Then it is recommended for trauma and burns also. Treatment of ulcer, you can just say that the immunity is increased. So, for that immunity part, there is more healing. Toxicity of vitamin C, excess vitamin C is excreted and is not accumulated in the body, and more than 2000 milligram may cause iron overload, okay. So, vitamin C is not able to keep this iron in the ferrous form, and in the ferric form is not absorbed, and it is sometimes being lost in the lost, and the one that is absorbed is has nowhere to go, and it is going on getting deposited in your it is all over your body. So, this the iron there is iron overload in your body. And that's all for vitamin C. We'll just we talked about the structure, the forms, the oxidized form and the reduced form. Then we talked about the dietary sources, the RDAs, and then we talked about the functions, main functions, mainly in the hydroxylation reaction, then heme synthesis, then steroid synthesis, and so many others. And hopefully you understood. And I think this will be my last lecture. Vitamin B12 most probably will be taught by the head of department, Sir Asghar Sultan, and hopefully you will have in Lippincott you have this chart in which there are different vitamins, and it's just like a summarized chart. You can just go through it, some of the functions, RDAs, dietary sources, they've just put it in a chart, and that's easy to study, though it's not enough. But yes, you for a Viva point of view, yes, you can just go through and give the Viva. Okay, students, thank you. Bye bye.